Hey OT dudes and dudettes, I'm Jeff with OTDUDE and you're listening to the OTDUDE podcast. In this episode, Telehealth for Occupational Therapy during COVID-19. The content in this episode does not substitute legal advice and you should always consult with a legal professional before proceeding with a telehealth session between you and your client. So I first heard about telehealth in OT school and it was more of a concept than a generally accepted practice. With COVID-19, telehealth is now a trendy topic both on social media and in professional practice. What you will gain from this episode is an appreciation for the benefits of telehealth, the challenges of telehealth from a technological and occupational therapy perspective, and the boring but important part, which is the legal considerations of telehealth. Now, I am by no means an expert on telehealth, but I have a background in videography, internet technologies, and computers in general. I am also a practicing occupational therapist in both acute care and an acute rehab unit. Most recently, I have used telehealth technologies with family members who are not allowed to visit their loved ones in the hospital. The AOTA has a lot of valuable resources to check out if you're considering implementing telehealth in your practice. I recommend that you Google AOTA telehealth to read up on the latest telehealth updates. In one of their older publications, the AOTA reminds us to consider first and foremost some ethical considerations. These include informed consent and consent to treat, privacy and confidentiality, effectiveness of service delivery, competency, compliance with licensure laws and regulations, and ensuring compliance with current standards of practice. Just as we do in real life, we need to consider the client's comfort level. Some may be hesitant to use the technology due to privacy and being recorded. Occupational therapists may need to discuss sensitive issues such as ADLs that include bathing or toileting during a telehealth conversation. OTs using telehealth are still expected to comply with privacy and confidentiality laws such as HIPAA. Another important consideration is the effectiveness of the technology. By nature of clients needing occupational therapy, they may have some deficits which impact the effectiveness of telehealth. For example, a child with ADHD may have short attention spans that make a long telehealth session difficult. Older adults may have sensory loss with hearing and vision. Poor fine motor coordination may make it difficult to interact with the telehealth system. However, due to the need for telehealth during this pandemic, a lot of technologies currently exist and are being improved upon. For example, the issue of fine motor control can be overcome by using voice-controlled assistants such as Siri, Amazon Echo, or the Google Home. Audio can be amplified with speakers, and considerations should be made when using telehealth from devices such as iPads and laptops, which may not have sufficient voice amplification. Headphones may also be useful. Screen size is also a consideration, and while iPad screens and laptop screens are large, clients with low vision may have difficulty due to poor visual acuity. Poor internet connection quality, video compression algorithms, and bandwidth can affect the overall experience. This can result in dropped audio or video, stutters, or delays between the two parties, all things that would not happen in real-life occupational therapy sessions. Competency. Occupational therapists should test, and test. This may seem obvious, but you should practice before going live so that you're familiar with using the software interface, and that the audio can be heard both transmission and receiving. Make sure that your video is well lit and that there are not too many distractions. Turn on your lights or sit next to a window. Some therapy sessions may not be appropriate due to safety concerns. Unlike in a live therapy session, you're not able to be there to catch someone if they fall or to assist the patient in any way. Because of this, patients may need to be higher level or you may need to have another caregiver next to them for assistance. I have provided some caregiver trainings virtually during COVID-19, and they went very well. However, our facility is still making some exceptions and having caregivers come in to do live training with the client and therapists. You still cannot beat real-life practice. You can demonstrate with the caregiver over telehealth, and they will say they understand, but the real valuable education comes in teach-back with the client. My family member is a speech therapist who works with children, and she has had a poor experience with some of her clients. The number one barrier she is facing is poor attention and engagement with her telehealth. I can see this working with some clients, but as with all occupational therapy sessions, they should be individualized in terms of intervention. The population that I work with, adults and older adults, are likely to have higher engagement than children would. That's not to say that children can't engage with the screen. In fact, many parents struggle to take away screen time from iPads, YouTube, and video games. So this tells me that the content that the children interact with on screen is what is affecting their sustained attention. Of course, we are all learning by trial and error to see what works. I have seen some videos of some creative interventions involving children and crafts for fine motor skills. While this looks good on video, it can take a lot of preparation on the parents' part prior to the session itself. So plan ahead and communicate with caregivers rather than winging it, so to speak. You may also be limited by what the camera angle can see, as opposed to in real life when you're able to see much more, such as posture, facial expressions, and so on. If something happens off screen, then you'll probably miss it. Still, telehealth can offer a lot of benefits for clients across the lifespan. Telehealth continues to be very valuable for patients who live remotely or who are in a low service area. Telehealth can also help to minimize exposure and can help to flatten the curve for COVID-19. So if you are seriously considering implementing telehealth in your practice or clinic, there are some legal things to consider. First of all, every state in the US may have their own specific rules and regulations. Does your state even allow telehealth occupational therapy? Do you have the support and technology to implement telehealth? With COVID-19, things may be changing every day. The AOTA has put together a chart of the latest state statutes regarding telehealth and whether it is authorized as a mode of delivery. For example, in California, where I live, in order to provide occupational therapy services via telehealth to a client, they must have a valid and current license. They must also inform the client about OT services and to obtain consent prior to delivering those services. They must exercise the same standard of care as with any other mode of delivery of occupational therapy services, including the ethical standards. I will provide a link to this document for your particular state. Another important consideration is insurance. The AOTA has uploaded a general document regarding telehealth coverage based on insurance, and it may be a good idea for occupational therapists to do their due diligence and contact the insurance company directly regarding reimbursement. There may also be special billing codes for telehealth as well. Check payer coverage frequently as this can change. As always, practice good technology security and use practices. Do not click on suspicious links, share passwords, or even leave devices unattended. I heard a story of a home health therapist who left their work laptop in their car, which got stolen. Even if the device is locked, you do not want this to happen to you and have the headache. I'll leave you with some telehealth etiquette. Test your equipment. Know where to get technical assistance. Obtain contact information ahead of time. Keep your filming location clean and clear of clutter and distractions. Close the door and window to avoid distractions and interruptions. Speak in a normal voice without shouting. Ask if the client can hear you and if there are any visual or audio distractions on their end. Good luck and happy telehealthing. Thanks for listening. I'm Jeff with OTDUDE, and I'll catch you in the next episode.